Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Jenny Septiliana. I'm from PBI 2. So today, in this video, I want a presentation about mental health and mental illness. The World Health Organization states that the quality of mental health is closely related to one's happiness mentally and psychologically. Individuals who have good mental health are aware of their personal potential, can handle normal life pressure, can work productive, benefit, and are able to contribute to their environment. Mental health and mental illness have different meanings. Mental health has no mental illness, but it is the ability to cope powerfully with life's challenges. Like physical health, everyone has mental health. To distinguish between them, physical health is the physical condition of the body, and mental health is the condition of the mind, feelings, and emotions. Being mentally healthy enables one to control one's emotions, think and age well, also to enjoy life in happiness. However, if health is poor, it can cause feelings of unhappiness, difficulty thinking clearly by stress situations. Definition of mental health. According of the World Health Organization, mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stress of life, can work productive, and is able to make a contribution to his or her community. Mental health conditions are disturbance in a person's thinking, feeling, or behavior that reflects a problem in mental function. They cause distress or disability in social, work, or family activities, just as the phrase physical illness is used to describe a range of physical health problems, and term mental illness encompasses a variety of mental health conditions. Many people have mental health concerns from time to time, but a mental health concern becomes a mental illness when ongoing signs and symptoms cause frequent stress and affect your ability of function. Next, mental illness. Mental disorders or mental illness are conditions that affect your thinking, feelings, mood, and behavior. Mental illness refers to a condition of individuals who have standard criteria of diagnosis such as depressions, anxiety, and pharmacological disorders. Mental illness significantly influences one's feeling through behavior and interaction with others. Next, types of mental illness. First, anxiety disorders. This group of mental illness is characterized by significant feelings of anxiety or fear accompanied by physical symptoms such as shortness of breath, rapid heartbeat, and dizziness. There are major types of anxiety disorders are generalized anxiety disorders, panic disorders, social anxiety disorders. Second, bipolar and related disorders. Formerly known as manic depression, bipolar disorders are characterized by alternating episodes of mania, hypomania, and major depressions. There are three broad types of bipolar disorders: bipolar 1, bipolar 2, and cyclothymia. Third, depression disorders. The common feature of all depression disorders is the presence of sad, empty, or irritable mood, accompanied by somatic and cognitive changes that significantly affect a person's capacity to function. Examples include major depression disorders and premenstrual dysphoric disorders. Next, feeding and eating disorders. Eating disturbances are characterized by a persistent disturbance of eating patterns that lead to poor physical and psychological health. Three major eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorders. Next, mood disorders. Next, personality disorders. These disorders are characterized by an enduring inflexible patterns of experience and behavior that cause distress or impairment. There are currently 10 recognized personality disorders. Next, sexual dysfunctions. Next, sleep-wake disorders. Next, trauma and stress-related disorders. This group includes disorders in which exposed to a traumatic or stressful event is listed explicitly as a diagnostic criterion. The most common is post-traumatic stress disorders. Next, gender dysphoria, formerly known as gender identity disorders. Gender dysphoria occurs when a person feels extreme discomfort or distress because their gender identity is at odds with the gender they were assigned at birth. Next, symptoms of mental illness. Signs and symptoms of mental illness can vary depending on the disorder's circumstance and other factors. Mental illness symptoms can affect emotions, thought, and behavior. Example of signs and symptoms include expansive fear or uneasiness, is feeling afraid, anxious, nervous, and panic. Second, mood change. Third, problem thinking. Inability to concentrate or problems with memory or logical truth and speech that are hard to explain. Fourth, sleep or appetite change, sleeping and eating dramatical, more or less than usual, noticeable, and rapid weight gain or loss. Next, withdrawal, sitting and doing for a long period of time or dropping out of previously enjoyed activities. Next, causes of it's important to note that the presence of one or two of these things alone doesn't mean that you have a mental illness, but it doesn't indicate that you may need further evaluations. If you are experiencing several of these symptoms at one time and they preventing you from going about your daily life, you should contact a physical or mental health professional. Next, causes of mental health. There is no single cause of mental illness. Instead, it's true that they stem from a wide range of factors, sometimes in combinations. The following are some factors that may influence whether someone develops a mental illness. First, your family history, your life experience, such as stress or a history of abuse, especially if they happen in childhood. Biological factors such as chemical imbalance in the brain, a traumatic brain injury, a mother exposed to virus or toxic chemicals while pregnant, use of alcohol or recreations, drugs, having a serious medical condition like cancer, having few friends and feeling lonely or isolated. Sometimes symptoms of a mental health disorders appear as physical problems such as stomach pain, back pain, headaches, or other unexplained aches and pains. Next, how are mental disorders diagnosed? The step to getting a diagnosis include the steps to getting a diagnosis include: first, a medical history; second, a physical exam and possibly lab tests. A physical exam, your doctor will try to rule out physical problems that could cause your symptoms. Lab tests, this may include, for example, a check your thyroid function or a screen for alcohol and drugs. Third, physiological evaluations. You will answer questions about your thinking, feelings, and behavior. Next, treatment. Treatment depends on which mental disorders you have and how serious it is. You and your provider will work on a treatment plan just for you. It usually involves some type of therapy. You may also take medicine. Some people also need social support and education on managing their conditions. In some cases, you may need more intensive treatment. You may need to go to psychiatric hospital. This could be because your mental illness is severe, or it could be because you are at risk of hurting yourself or someone else. In the hospital, you will get counseling, group discussion, and activities and activities with mental health professionals and other patients. Next, and last conclusion, the American Psychiatric Association states that many others are reluctant and embarrassed to admit that he has a mental. While mental illness is a medical condition, as is heart disease and diabetes, as surely as a disease can be treated, illness can be experienced by anyone, regardless of age, gender, geography, income, social status, race of ethnicity, religion or spiritual, sexual orientations, background, or other aspect of culture identity. A person may be in good mental health, but he or she may be diagnosed with a mental illness. This is about the same as person who feels physical may not be suffering for a serious illness. Similarly, a person with poor mental health can avoid having a certainly mental illness. So, what is to say is that keeping in mind is important for everyone, even for those who are not diagnosed with a mental illness. Taking care not only of the mental health but also of the physical care that contributes to the mental conditions. Ensuring that you live a healthy lifestyle include exercise, nutrition meals, sufficient rest, consumption of alcohol and illicit drugs is a series of endeavors that can be made to maintain mental health. I think enough. Last I say wassalamualaikum warahmatullahi wabarakatuh.